You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone. Welcome to the show and thank you so much for joining me. I'm recently talking about dental mercury detox and dentistry without mercury. In the previous episodes, I've talked about the science behind mercury, what that does to your health and well-being, the impacts of dental amalgam because they contain mercury. Yes, those silver metal fillings in your mouth contain mercury, and this is one of the big no-nos in holistic dentistry. The recent episode last week, I talked about supplements that you can take as part of your detox. These are recommendations and not medical advice. Here comes the disclaimer. You need to seek the support of a GP, naturopath, integrative doctor to support yourself with any dietary and supplementary changes and any detoxes. And these are just things that I am pointing out so that you can get some guidance as to what does and what doesn't work and what the science is behind them. So in today's episode, I'm going to be talking about the dietary things that you can do to help reduce and countermand and eliminate mercury from your system. So if you'd like to know more about holistic dentistry and what that means and how that applies to you, then you can hop on over to holisticdentistry.au, or you can jump on to my dental practice website, which is evolvedental.com.au. But for now, let's get in the zone. So I'm going to assume that you've listened to the previous show and that you're going to start making some changes to the supplement program, and that you're going to have some benefits from this, and that you're going to want to really maximize what you can do to eliminate mercury from your system. So these things are recommendations for if you have amalgam fillings and you've not yet had them removed and you're planning to remove them. These will support you prior to the process, during the process and after. But if you're in a situation where you can't find a dentist who can safely remove your amalgams yet, a SMART certified holistic dentist, and SMART stands for Safe Mercury Amalgam Removal Technique, which means they're going to follow all the correct protocols and guidelines to minimize your exposure to mercury during the process. And it is something you can take while you still have amalgam to help reduce and offset some of the effects of having mercury leaking into your system every day. And it's also a really good way of supporting your body after amalgam removal to help reduce the mercury body burden even further. So let's assume that you've started the supplement program or you've had your amalgams removed and you're starting to see some benefits from that supplementation program. Well, what are the steps can you do to help your body cope more effectively with the stress of heavy metal exposure? Well, I'm going to say that first and foremost, dietary changes is a really key thing. So there's some dietary changes that can help with that overall goal of reducing the intake and increasing the excretion of mercury. Now, we all know, and if you don't, then I don't know where you've been, that the largest dietary source of mercury comes from fish and fish products. This is why we tell pregnant women not to eat tuna, for example. But hey, are any doctors telling pregnant women or women who are considering a pregnancy to look at their dental amalgam to see whether they've got these mercury fillings in their teeth before they try for a baby? Or I don't think so. So they're told, don't eat fish products because this is the largest source of mercury, and we all have to some extent become aware of that. You should be very selective about the amount of fish and the type of fish that you eat. Freshwater fish or fish caught in coastal areas should be avoided because it usually contains high levels of mercury and other toxic substances. Limited data available indicates that some fish have comparatively lower mercury contents. Some of these are things like the good fatty fishes like sardines, herring, mackerel, cod, and halibut. Most tuna has a fairly high content of mercury, and even though the selenium levels in tuna may offset the effects of mercury, discretion dictates avoiding tuna during mercury detoxification programs. Intake of shellfish should also be eliminated or greatly reduced, as shellfish are scavengers and usually contain high levels of heavy metals. Patient case studies and histories indicate that individuals who are sensitive to mercury usually have some type of adverse reaction from shellfish anyway. There is another aspect related to fish products that mercury-sensitive individuals must consider. Fish meal has become a major feed for chickens. Consequently, depending on the mercury content of the fish products used to make the fish meal, chickens and eggs have the potential of having significant mercury content. That's quite shocking to me. That, when does a chicken, let me just go on a little bit of a side tangent here. When does a chicken eat fish in nature? Do you see chickens swimming in water and catching fish? No. So why are we messing with the food chain so much that we're feeding fish meal to chickens? Did we learn nothing from mad cow disease in the UK, where they were feeding the brains of sheep to cows when cows eat grass? What is wrong with us? Anyway, that's not the topic of this podcast, but it just blows my mind that we are so dumb sometimes as human beings that we can go against nature and think that that's okay to make a profit, to increase the way our livestock grows and does things. No, it's beyond me. Let's go back to how nature says things should be, and let's keep things simple. Anyway, back to this. So we've talked about if you want to reduce your body burden of mercury, you don't want to be ingesting more mercury, then you've got to watch your fish. Sardines are a fantastic source of fish. Wild salmon, also a very good source of fats and proteins, and salmon does not tend to accumulate mercury from my understanding. So if you want to reduce your mercury release from your amalgam fillings, a couple of things to avoid. It's not really a food, but chewing gum, because every time you chew on those fillings, you're stimulating mercury. So I always say to patients who've got amalgam fillings, no chewing gum. The other thing is lollies, sweets, candies, because the bacteria in your mouth will produce lactic acid from sugar, which speeds up the corrosion of the fillings. And that corrosion of the fillings creates a larger surface area, it creates a breakdown of the filling, and it speeds up and increases the release of mercury from that material. Other thing that you need to be aware of, I like my patients to brush their teeth and keep things nice and clean, but when you've got mercury fillings, you don't want to be brushing more than 2 or 3 times a day, because every time you brush your teeth, you're stimulating the surface of the filling, just like with chewing gum, and you're releasing mercury vapor into your system. You need to ensure that you routinely eat a high fiber diet, because this will help your bowel movements to be speedier, and it will help do what we call decrease the fecal transit time, and that's the amount of time that liquids containing heavy metals remain in your colon. This will reduce the quantity of mercury that gets reabsorbed from the colon, that then passes through the portal vein into the liver, and is then recirculated through the body. This is called enterohepatic circulation. So it takes what it needs from your gut to be able to absorb and assimilate that, and then it goes through the liver and out into your body. Just as a little side note here, I talked about in the previous show about zinc supplementation and how not to take that on an empty stomach, because it can make you feel a bit nauseous and even make you throw up. You should not take your zinc supplement with high fibre food. High fibre diets may contain excessive amounts of phytic acid, and phytic acid binds to zinc and can lead to zinc deficiency. Have your doctor or your physician check your zinc levels, as you may require extra zinc to maintain a proper zinc ratio. So let's just focus on fibre here for a moment, as that's where I was going and got a bit sidetracked there by the zinc comment. There have been studies done on mice that had been exposed to methyl mercury, and these studies were done to determine if fibre and fibre intake made any difference to the whole body retention of mercury. The incorporation of about 30% wheat bran in the diet of the mice significantly decreased the total mercury concentration in the brain, blood, and small intestine. And the researchers felt that the wheat bran exerted its effects on mercury retention and brain levels of mercury via a modification of the metabolic activity of the gut microflora. Another study stated dietary fibres absorb many bile acids, metabolites, toxins, and electrolytes, and promote detoxification of the organism. Due to ion change properties, dietary fibres are capable of removing ions of heavy metals. So you need to make sure you're eating your greens and your veggies. Yes, your mother was right. You need to eat your greens, but in this case, it's because it helps mop up mercury. Many studies have established that the bacteria in the gut of animals who have had amalgam fillings placed in their teeth, those bacteria in the gut become mercury resistant. And this is a fact that we know in human beings with amalgams as well. The significance of this is that these bacteria will convert various forms of mercury into mercury vapor, which can then be reabsorbed and recirculated in the blood to the brain and other critical organs in the body. This can also lead to antibiotic resistance, which is becoming very, very prevalent and a big issue. And it's a serious problem for the medical profession because, if you've got antibiotic resistance and you've got an infection, what are you going to do to treat that? It appears that a high fibre diet will cause the excretion of large quantities of mercury-resistant bacteria into the faeces, thus reducing the amount of mercury vapour to be recirculated. There hasn't really been specific research with oat bran and mercury that we're aware of, but oat bran added to the diet may be equally as beneficial because of the cysteine and methionine content. Oat bran also provides the added benefit of reducing cholesterol levels. Oat bran increases the excretion of bile acids, which are made from cholesterol, as well as increasing the excretion of bile in the feces. As mercury is carried by the bile into the intestine, an adequate fibre intake decreases the amount of mercury available to be recycled back to the liver. So if you want, you can get some additional fibre by eating oat bran or bran muffins. You can take a supplementary fibre, like phylum husk and those sort of things. I prefer it that way because it's less bulky. I don't have to eat quite as much. I'm not a big fan of oats. I have a gluten intolerance, and here in Australia, oats have gluten in them. Yes, they do. So you need to be careful with that. Anyway, you can take a supplement, but if you are supplementing fibre or increasing your fibre, it's really, really important that you drink an adequate amount of water. And I'm talking water, not fluids, because when we talk fluids, people think coffee and tea and they dehydrate you. I'm talking water. For anyone taking this supplement, you're getting your fibre in. I've just said you're going to need to drink more water. You need to drink water, and that you build up the amount of fiber consumed very slowly. Don't just go ballistic. You've got to let your body adapt to this, because taking excessive fiber can have the opposite effect and result in blockage of the large colon and therefore constipation, and you're going to have the reverse effect of what you want, which is to decrease the transit time of your feces in your colon so it passes through quickly. So you want to be drinking at least 6 to 8 glasses of non-fluoridated water daily, as this will assist in your body getting rid of toxins, and it'll help with the transportation, and it'll help you deal with your increased fiber intake. The type of intestinal flora and the status of that intestinal flora plays a significant role in the excretion of both methyl mercury and inorganic mercury in your feces. Stress and the use of antibiotics can reduce viable strains of intestinal bacteria and cause overgrowth of undesirable strains. So you've got your good bacteria and your bad bacteria. You want your good bacteria. When you've got stress, when you've got your diet out of whack, when you've been on antibiotics, you're going to reduce the quality of your intestinal flora. One way the body rids itself of mercury is via the bile, which empties into your intestine. If your gut flora is impaired, then mercury, and for that matter other heavy metals that would have been excreted in your poop, in your feces, are recirculated back to the liver. So including items in your diet that are rich in favourable bacteria will help. So if you want to, again, I don't do dairy, you can use unsweetened yogurt, the one with live cultures. You can use acidophilus supplements. You can use buttermilk and other soured milk products. Again, I'm not a fan of dairy and I don't advocate it during mercury detox. I would rather you take something like acidophilus and replace your gut bacteria that way. There's also protocols that you can do to cleanse your colon of heavy metals, and I may touch upon those today or in a later episode. So let's look at what dietary things you can do beyond, avoiding sugars and making sure that you're not eating fish that contains mercury and getting plenty of fiber. So I'm going to look at what foods, what dietary sources provide particular nutrients that are supportive for your overall health, your digestion, but particularly for mercury detox. And I'm going to list the foods in the order of content. So the ones that have the most of this product or the most of this particular nutrient, I'll list first, and then they'll go down in descending order. So selenium, and if you want to know more about these things like the selenium, zinc, thionine, thymine, methionine, cysteine, glutathione, then listen to the previous show and that will go through all that for you. So selenium, butter, smoked herring, Brazil nuts. Brazil nuts, great source of selenium, really simple way to do it. 5 Brazil nuts a day and you're done. Cashew nuts, wheat germ, scallops, barley, whole wheat bread, milk, brown rice and brewer's yeast. A lot of those things I don't recommend to my patients to eat. I don't think that they're really supportive to overall health and reducing inflammation. But if you want to get selenium, then I'm going to just go Brazil nuts. Super simple. Zinc, herring, then your sunflower and pumpkin seeds, they're great. Steak, lamb chops, one of my favorites. Pecan nuts, Brazil nuts again. Do you see how nature provides everything in one little package? Beef liver, egg yolks, again, whole wheat bread, oats, almonds, sardines and chicken. That's in descending order. So if you really want to go zinc, You get your sunflower seeds, your pumpkin seeds, really the easiest way again, and you can just sprinkle those on a salad or on porridge. You can put them in smoothies. Thiamine, that's vitamin B1, wheat germ, rice bran, yeast, ham, dried raisins and prunes, asparagus, beans, broccoli, cauliflower, corn, lentils, brown rice, almonds, cashew and eggs. Again, good sources of vitamin B. You can just take a vitamin B supplement and you'll get what you need. Then methionine and cysteine. These are amino acids, so they're going to come from proteins. What you've got to look at though is that the sulfur amino acid content of various foods is not readily available, so it's hard to kind of determine how much is in there. As a general rule, recommendations as good food sources of sulfur-containing amino acids have been wheat germ, yogurt, cottage cheese, pork, sausage meat, turkey, eggs, beans, Brussels sprouts, onions, garlic, hot red peppers, horseradish, cabbage, brown rice, sesame seeds, pumpkin seeds, oat and granola and avocado. But what you've got to also understand is that the amino acid L-leucine inhibits transport of methyl mercury cysteine complex across the blood-brain barrier. Therefore, it seems prudent to provide small amounts of cysteine in conjunction with significant quantities of leucine and the other amino acids which compete for the L-amino acid transport system, including valine, isoleucine, phenylalanine, tyrosine, and tryptophan. I know, that's the science. So if you look at something like whey protein derived from milk, that contains cysteine and cysteine, and a lot of other branched chain amino acids. Therefore, a high-quality, partially hydrogenized whey protein provides a good source of cysteine and cysteine to support the intracellular glutathione production and metallothionein synthesis. I've covered all that in the previous episode. And again, you need adequate leucine to minimize the transportation of metals into the brain and central nervous system. Dietary intake of refined carbohydrates, sugars, and saturated fats should be reduced. These type of foods have high energy requirements for metabolism and may well reduce the availability of essential enzymes and nutrients required for beneficial purposes. So what I tend to recommend to my patients as a very simple overarching guideline is lots of green leafy veggies, particularly your ones that contain sulfur, so your broccolis, your Brussels sprouts, cabbage, onions, garlics, then eggs, particularly free-range ones, good quality protein, so ones that are easy to digest, so a lot of your chicken and fish, but again, careful with your fish. I then will recommend things like lamb, red meat once or twice a week just to help get the zinc and other fat-soluble nutrients. Then we would be recommending pumpkin seed, linseed, Brazil nuts, and that would really then give you a good supportive role. I recommend smoothies, alkalizing greens. These help get the fiber content up, phylum husk, LSA, which is linseed, sunflower seed and almond, so flaxseed, which is also the same as linseed, and those can be all zhuzhed up in a smoothie with a protein supplement. You can add some mineral salts to that and lots of water, and you're essentially getting a really good mercury detox. Other foods are things like coriander, that's been shown to be beneficial for helping to reduce mercury levels. Don't really understand the science behind that and haven't got that at my fingertips today, but yep, that's something that is recommended. So you can make like a coriander pesto. I hate coriander, by the way, but if it's in things and I can't taste it, then I'm pretty happy with that. So I'll always say to somebody, like a curry with all the different spices, then you sprinkle that with some nuts, some seeds, you're going to be good to go. But you've got to get your fibre up and you've got to drink plenty of water. So there are a lot of things you can do dietary-wise to help support your body. And there are also lifestyle changes that you can make. There are many things that you can do that will augment any effects being achieved through nutritional supplementation and diet modification. Perhaps the most important change to make is to reduce the amount of stress to which your body is routinely subjected. This is essential because stress depletes your body of key nutrients. So you've got to look at things that are going to help you relax and unwind. You need to get good quality sleep. You need to be able to manage your stress levels a lot better. And, just something like learning just to take a steady breath, to just reconnect to yourself, to, take a moment. Is this really important? What can I do to slow down? Where can I ease some of my load? Where can I, say no to a few things so that I can make my health and my time a priority? So very, very important to look at what makes you stress and how you can reduce that. Exercise is important. If you're not exercising, you should establish some sort of schedule for yourself that results in you performing physical exercise at least 3 times a week. And you want each session to be at least 30 minutes in duration. Now, before you start any exercise regime, make sure you check with your doctor if you've got health problems. Doesn't need to be really intense exercise, just walking, swimming, stretching, cycling, a little bit of lightweight training. What you've got to understand is that your metabolic processes have probably been weakened from mercury accumulation, and the additional stress derived from exercise may be detrimental. So you need to be certain to consult with and attain approval from your physician before you initiate any vigorous exercise program. Aside from the physiological benefits of exercise in this instance, there's a more immediate detoxifying benefit that you will accrue if you can work up a sweat. Like I said, you don't have to go too intensive, but you do need to get sweaty. And the reason is sweat is one of the body's mechanisms for getting rid of toxins, including some heavy metals like mercury. In fact, induced sweating is the therapeutic modality used to detoxify workers employed in the mercury mines in Spain who have suffered excessive exposure. Sweating can also be induced by taking periodic steam baths or saunas, providing that your medics approve. So we're looking at reducing stress, increasing exercise, getting sweaty, having saunas, having steam baths, and these are some of the lifestyle things you can do. Now, this would make complete common sense, but if you smoke, give up smoking. If you drink alcohol, reduce alcoholic beverage consumption or stop completely. And I know that's easier said than done for most people, but you can reduce your intake or use of tobacco and alcohol. And you can do this usually without causing too much mental stress or withdrawal. And it appears that the benefit from limiting or stopping is associated with reducing the chemical stress on the body, which biochemically uses the same nutrients that you're trying to rid or reduce your burden of mercury with. So I will also speak to my patients about reducing sugar intake, dairy and gluten, because these also put a lot of strain on the immune system and digestive system. They will compete with the nutrients that you need to help eliminate mercury as well. They also create acidity, and then you're using up all your antioxidants to deal with that. Acidity is going to create inflammation, and again, that's going to hamper your ability to detox mercury. Now, if you're pregnant, I'm not advising you take any supplements or make any dietary changes, and you certainly don't get amalgams removed while you're pregnant. It's not something we want to do. It's also in a handout that I got in 1992. I'm showing my age here. As a very young dentist in the UK, we were given an advisory not to remove or drill out amalgam fillings in pregnant women because of the theoretical risk to the fetus that says, hey, how long ago was that? 1992, you do the maths. They already knew. They already knew back then the mercury is toxic and gets released from the amalgam fillings whilst drilling, which means they already knew the mercury gets released from the fillings, full stop. It's my view, and I'm very strong on this, and mercury fillings should not be replaced during pregnancy because the temporary increased mercury body burden that might result can increase the potential of toxic effects occurring in the fetus or embryo, particularly if it occurs during the first trimester of pregnancy. It has been stated by some world leaders on mercury toxicology, comprehensive amalgam work on pregnant women should not be performed. Only dental care deemed absolutely essential should be provided, and amalgam is not to be used for any of the work that must be done. If you have a mouthful of amalgam dental fillings and are having a routine cleaning, do not permit the hygienist or doctor, the dentist, to polish or use the ultrasonic scaler on any amalgam surfaces. Now, I have patients who still have amalgam. When I am descaling and cleaning their teeth, I do not touch those amalgam fillings. I clean around them, I clean under the gums of those teeth, but I do not touch or polish the amalgam fillings, because polishing those amalgam surfaces or using the ultrasonic scaler on those greatly stimulates the mercury release. So to make it very, very clear, during pregnancy, dental work that would mean stirring up any amalgam mercury-containing fillings should only be done if it's absolutely essential, if you've got like a raging toothache and that needs to be addressed. And again, it needs to be done with smart protocols, rubber dam, separate air supply, air filtration, everything that we can do to minimize your exposure to mercury during that process if we have to do emergency dental work while you're pregnant. And it's therefore, if you're having any dental work done during pregnancy, I would really urge you to discuss your care with a well-trained holistic dentist so that they understand what's going on, that they're going to be doing the proper protocols and are going to replace the fillings with non-mercury containing materials. And there have been times, during my career, I've had to do this for pregnant women. We've had a very long discussion and we've worked with their GP to support them to take some supplements and detox protocols. So if you are pregnant, you're probably thinking, well, what the heck, what am I going to do? I've got amalgam in my teeth. Is there nothing that I can do? What you can do is stop chewing gum. You can eat a diet rich in sulfur-containing foods. You can take some supplements in conjunction with your GP. Make sure that you're getting your quantities of zinc, and then limit your intake of fish and seafood. With regard to that, you need to also understand that mercury does pass in the breast milk and it can be passed to the child through breastfeeding. If you take selenium supplements, this will decrease the amount of mercury in the breast milk. So there are things you can do to mitigate it. If you are a teeth clencher and grinder, I would also recommend a nighttime guard so that you're not rubbing your teeth and causing friction on those amalgam fillings. So if you're planning a pregnancy, then the decision is much simpler. If you've made the decision to have those mercury fillings replaced, we recommend amalgam replacement for both the male and the female to be completed 6 months prior to attempting to conceive. The 6-month period following the final amalgam replacement permits your body to reduce the body burden of mercury and your body chemistry to rebalance or adjust to a level where it's going to be safe enough to conceive a child. So let's look at supplementation during and after amalgam replacement. I frequently get asked about programs prior to as well as after mercury amalgam removal to help the body to detoxify, reduce the existing body burden of mercury, to assist you with coping to the redistribution of mercury that's going on during the removal. And I'm going to give you a regime of nutrients that is based on scientific literature that may be of help. This should not be confused with the self-testing program previously outlined, which was designed, that was in the last episode, the last show, that was used to determine if mercury was involved in your symptoms that you may have had. Now, the following list comprises the nutrients that the scientific literature has indicated may be of benefit during your dental detox program. It does not mean you should take all of them. You should individualize your program, work with a naturopath or an integrative GP. The nutrients I consider to be most important, I will point out to you. If you've been on a supplementation program, you may be able to find specific formulas that provide a great many of nutrients in a single capsule or tablet, requiring you only to take as many as needed to achieve the desired amount. So don't just go, oh, I'm taking this, I'm taking that, I'm going to add this, I'm going to add that. Just take your time, read the labels, see what you're getting, and you may find, oh, well, if I take that, that's already got a B vitamin in, or it's already got some zinc, and I don't then therefore need to take any extra. So let's have a look at pre-amalgam replacement supplements, and these should be started as soon as possible. If we're going to do big amalgam removal, I like my patients to preferably start this a month before, no later than 2 weeks prior. I often have, though, a lot of patients who travel and they're coming to see me in Brisbane and they're basically only there for a week or two. So we'll talk to them on the phone or via email. We'll give them some guidelines, get them just to start as soon as they can. And sometimes we haven't started at all and we just have to go straight in. It's not my preferred way of doing it, but the patients understand that it's their choice. And at the end of the day, they've made that decision. And my job's to help them get the amalgams out. But if you can start some sort of regime a month or so before your amalgam removal, that's really going to set you up well. So let's get into that. Glutathione, super important. It's a tick box. This one, pay attention to. Glutathione, 150 milligram capsule or tablet 3 times a day, taken on an empty stomach. Number 2, methionine. Take a 200 to 500 milligram tablet 2 to 3 times a day. Do this on the same schedule as the glutathione. The desired intake is to get at least 1,000 milligrams a day. And as with all new supplements, just start 1 tablet a day for the first few days. Make sure everything's going okay. Then if you've got no problems, you can add the second and third tablets. The importance of adding methionine to your detox program is glutathione contains cysteine, glycine, and glutamic acid. But of these, only cysteine ever seems to be in short supply. The liver apparently manufactures glutathione whenever extra cysteine is available. Blood glutathione levels change in direct proportion to the amount of cysteine in the diet. Methionine levels are a major determinant of the liver's concentration of sulfur-containing compounds such as glutathione and cysteine. As methionine is the precursor for the manufacture of cysteine in the body, extra supplementation of this crucial amino acid should also increase your available cysteine. Another important one, Selenium, 150 microgram tablet or liquid equivalent of sodium selenite. Vitamin C precipitates selenium, making it unavailable for absorption. So don't take your selenium at the same time as you take vitamin C. Make sure they're about 2 hours apart from each other. If you find that you are sensitive to selenium or it doesn't agree with you, then you can take some vitamin E. Vitamin B1, this is another important one. In fact, I'm going to probably tell you all of them are important. A 150 milligram tablet with each meal. On the day of your dental appointment, you may wish to increase your dosage of vitamin B1 to 200 to 500 milligrams 1 hour before your dental appointment. Research has shown that vitamin B1 is capable of reducing pain, and that would probably help you with your routine dental procedures. Increased dosages may be used the following day to assist in controlling residual pain. Vitamin B1 is one of 2 vitamins containing sulfur, the other is biotin. There is also another form of vitamin B1 available that is now fat soluble. As mercury vapor is fat soluble until it is oxidized, fat-soluble vitamin B1 has the potential to be of great assistance in offsetting the toxic effects of mercury. Vitamin B1 for reduction of mercury body burden. There's a study that demonstrates that 2,000 milligrams per day was very effective in reducing the body burden of lead, and lead has some of the same biochemical pathways as mercury. As with any supplement or medication, do not stay on high intakes for extended periods without discussing this with your doctor beforehand. Vitamin B6, another important one, pyridoxine. You take a 50 milligram tablet per day with breakfast. B6 is needed in the metabolic process that converts methionine to cysteine and then onto glutathione. B6 is capable of reducing and controlling the swelling and pain associated with routine tissue and bone trauma damage resulting from normal dental procedures. Typical doses used to assist in the reduction of post-operative swelling have been 100 to 200 milligrams 1 hour prior to dental work and another 100 to 200 milligrams after you get home. The next day, you can take 200 to 300 milligrams if the swelling has persisted. Do not use high doses for more than 3 to 4 days, and that should be done under supervision of your doctor. Vitamin C, important. 1 500 milligram tablet with each meal. Vitamin C is an antioxidant. It's a detoxifying oxygen-free radicals and is really good at restoring used vitamin E to a functional state. It should be noted that most vitamin C products are derived from corn. If you have known allergies to corn, then there are products available made from mineral ascorbates, and these may be more suitable for you. However, just a little caveat on vitamin C. Anecdotally, and I don't know how true this is, in some individuals, vitamin C can affect the way they respond to dental anesthesia. It means that the anesthetic can wear off quicker, or you may not be able to get numb so that we can work in that area. So we're often saying to people, you maybe want to just back off your vitamin C for about 12 hours or a day or so before you have your dental work. You might also want to consider having intravenous vitamin C. There's shown that this greatly increases the excretion of mercury via the feces, but there isn't really super scientific evidence on this. However, it does seem to be very beneficial. Zinc, you're going to take 1 15 to 30 milligram tablet after supper, not on an empty tummy. Magnesium, again, super important. 2 or more tablets or capsules per day, providing a total of 200 milligrams of elemental magnesium, taken after supper or at bedtime. So just read your labels there. They usually state the total number of milligrams of the mineral it takes to provide the elemental dosage. Magnesium is essential for the proper functioning of your immune system, as well as hundreds of enzyme systems to human health. About 70% of the body's biochemical processes rely on magnesium. It also helps you sleep better and relaxes your muscles and helps you reduce stress. Inorganic preparations of magnesium are less expensive than the organically bound ones and are often adequate. Thiotic acid. This is alpha lipoic acid, or ALA. It has good antioxidant properties. Lipoic acid has metal chelating capacity, and it has an ability to scavenge reactive oxygen species called ROS, and it has the ability to regenerate antioxidants, vitamin C, vitamin E, and glutathione, and it has the ability to repair oxidative damage. So this makes it a model antioxidant compound. The greatest asset to detoxification is the ability and the capability to increase cellular reduced glutathione. Cells whose thiol status has been severely compromised are normalized by lipoic acid. This is of great significance to individuals whose glutathione levels have been depleted in the process of controlling oxidative damage that is caused by chronic exposure to dental mercury. There is evidence that various metabolic antioxidant properties of ALA may be effective in numerous neurodegenerative disorders. There are some scientific evidence that high doses of lipoic acid may be counterproductive. Do not think that more is better. Start with a 100 milligram capsule for a couple of weeks, and then you can experiment and add a second one and see whether you notice any added benefit. This is an optional one. You can take milk thistle, 100 milligram tablet or capsule three times a day with meals. It's going to provide support and protection against liver toxins and can cause which can cause free radical mediated oxidative damage. Milk thistle is many more times potent in antioxidant activity than something like vitamin E. It will increase liver production of glutathione, protect your red blood cells and membranes against lipid peroxidation, which means rancid fats, and hemolysis, which is the breakdown of red blood cells. Important, vitamin E. If you can take vitamin E and it doesn't affect your blood pressure, then you can supplement 100 to 400 IU capsules. The desired dose is 800 to 1200 IU per day. If you've previously experienced any adverse blood pressure reaction with vitamin E, then you should start at the lowest potency available and take no more than 50 to 100 IU per day for the first 30 days. You discontinue vitamin E if any time you have adverse reaction or increase in blood pressure. You can get vitamin E from food sources, so wheat germ oil, sunflower seeds, almonds, sesame oil, peanut oil, olive oil, and peanut butter, good food sources of vitamin E. Another important one, acidophilus, taken regularly will help restore the microflora of your gut, which will be adversely affected by the presence of mercury in any form. Also, taking acidophilus will reduce bad breath by replacing the bacteria and organisms responsible for producing unpleasant odours with good bacteria. It will reduce flatulence by breaking down sugars that promote and are consumed by methane-producing bacteria. It will regulate cholesterol by promoting normal absorption of dietary fats It will facilitate in the eliminating of unwanted cholesterol before it's absorbed, and it will help normalize the gut to reduce constipation and diarrhea. So I've given you all the primary nutrients that have been scientifically shown to assist in the elimination of mercury from the body and afford some degree of protection from mercury-induced damage. In addition, you can take the following products because these have also been shown to be of benefit. So vitamin B12. There is limited information around this. However, because we need thiol and sulfur components to detox and eliminate, vitamin B12 is very supportive because it helps in those processes. I could give you all the science there, but I'm just looking at my notes and it's a little bit confusing, so let's not go into that. But you can take vitamin B12 to just give you a little bit of support there. That's why I recommend a vitamin B complex to my patients. You can take a good protein supplement because that's going to help produce your cysteine and support your glutathione production and metallothionein synthesis, as well as giving you your levels of leucine that are going to minimize transport of metals into your central nervous system. Then you can take EDTA. I feel that's more beneficial for lead, but certainly something you can speak to your doctor about. Not something I'm going to go into here, but just to touch upon that. I'm also going to talk about N-acetyl L-cysteine, NAC, which forms L-cysteine, cysteine, L-methionine, and glutathione and mixed disulfides. This compound has the ability to stimulate your own body to produce large amounts of cysteine and glutathione, and this greatly augments the plasma and red blood cell content of both cysteine and glutathione. In experiments where animals were exposed to mercury vapor, NAC treatment increased survival time and decreased mercury levels in the blood, lung, and kidney. So you can take a vitamin B complex, and this should provide at least 15 to 25 milligrams of each of the various B vitamins. Take the number of tablets indicated to produce the desired amounts. There's been talk about activated charcoal. It's not something that I longer do because with the rubber dam and the way that we shield you off, I don't feel it's as necessary because we used to recommend it in the past before drilling out amalgam because it binds any swallowed mercury and will prevent any recirculation of it from the gut through the liver. So you can take a dose before your appointment and afterwards. I don't really think it's necessary. And there is some evidence that NAC and methionine will absorb to charcoal, and that's going to reduce their availability. So I'm not a big fan of it because it can stop you being able to assimilate your nutrients. Bromelain, which is an enzyme derived from pineapple. This can help reduce swelling and inflammation after treatment, so might be something you want to take. And then another one is molybdenum. That shows it can decrease the renal or kidney tissue accumulation of mercury and can help increase urinary excretion of mercury as well. Any supplementation is to be done under the care and supervision of your medical and health practitioner. You must seek medical advice. I am not telling you what you can and can't take. This is just a guideline. You must make sure that you're following medical advice. So that's the before amalgam removal protocol or guideline. Probably want to go back and listen to it a few times with pen and paper. it's kind of hard to present it in a way that it's really simple, like take this, do that. But go back and re-listen to it, and then you can note that down and you can have that information at your fingertips. I'm going to move on to post-amalgam replacement. If you're not experiencing any problems, then really simple, no change in supplementation is required. You may, and you need to be aware of this, you may experience some increase in your symptoms, and that's not unusual. Often patients will develop flu-like symptoms for 2 or 3 days following the amalgam replacement appointment. If after about a week there has been worsening of any existing symptoms, or you experience new symptoms, you can make some changes to the program. If you've experienced a new symptom that was not present prior to supplementation, they may be caused by either the supplement itself or the particular brand you're taking, and that's why we do that little pre-amalgam to see if the supplements are working for you. If you do feel it's the supplements, then just stop taking everything and restart taking them 1 or 2 at a time for 2 or 3 day periods in attempt to work out which is the one that's the offender. If the supplements have been well tolerated and the reactions occurred only after amalgam replacement, then I'm going to advise you try the following steps. If after increasing dosage as indicated, you experience an increase in any symptoms, stop taking all supplements and seek professional assistance. So I would increase your vitamin C to 1,000 micrograms, so that's a gram of vitamin C with each meal, and another 1,000 micrograms 1 hour after supper. Add vitamin B5, panthenoic acid, 100 milligram tablet or capsule with breakfast and supper. Add an amino acid complex, because mercury has the ability to deplete or impair your utilization of several amino acids, and some physicians indicate that addition of amino acid complex can supply the proper balance. Take 1 hour before meals or at bedtime. Preferably your detox should start 1 month, no less than a couple of weeks before your amalgam removal replacement, and continued throughout the treatment plan. And then after completion of your dental treatment, after all your amalgams have gone, continue on the detox program for about another 60 to 90 days. I usually say to my patients at least 6 months. So you take it at the quantities recommended for the first 60 or 90 days, and then just ease that back gradually over the next 60 to 90 days. You'll be the best judge based on how you're feeling as when to reduce, modify, or stop your supplements. After reviewing case histories and having conversations with amalgam poisoned individuals, it's very clear that you may need to maintain supplementation for years after your removal of amalgam, because mercury can remain in your tissues and organs for a very long time. And look, no single detox program is going to fit everybody and your biochemical needs. This is kind of an overview. It's a generic one size fits all, and we know one size does not fit all, but it gives you some guidelines. Some programs are very aggressive and are based on the premise that the faster you reduce your total burden of mercury and other heavy metals, the quicker you'll get well. Again, more is not always better. More aggressive is not better. Faster is not always better. It's evidence that once the sources of contamination have been eliminated, so getting rid of your mercury from your teeth, providing the basic materials for your own body to regain its ability to slowly and effectively eliminate residual mercury and other environmental hazards should over time greatly strengthen your health and help reduce your risk of disease. Detox is more than just taking supplements. I've touched upon it here. Dietary and lifestyle modifications are essential. please make sure you do those. Have your high fiber diet, give up your chewing gum until all your amalgams are replaced, have some sweat therapy, have a sauna, get some sweaty exercise, and this will help regulate toxins. Make sure you drink lots of water, and you can even look at infrared sauna and those sort of things. Pregnant women and individuals with high blood pressure or heart disease, please get approval from your doctor before initiating any sweat therapy. So I've gone through in as much detail as I can for you in this episode, in this part of the Dental Zone today, what supplements you can take. In the previous one, I've talked about diet and lifestyle. I've talked about supplements for before amalgam removal, during and after. Essentially, you just want to give your body everything it possibly needs and everything it's possibly been depleted of that can help you eliminate your reserves and stores of mercury, help you to cope with the detox process and any flare-up of symptoms. And when we detox, most people who've done a detox will tell you they do feel a bit kicked around. You feel like you're going to get the flu. You can get aches and pains in your joint, headaches, nausea. So we want to help offset that as well. Again, I would go back, recommend you listen to the episode, take your notes, have get your list of what you want to take, have a look what supplements are available, speak to your physician, your healthcare provider, get the advice that you need, work with a really well-trained, holistic, smart, certified dentist, and this way we can help you reduce your mercury levels and get you on the road to good health or staying in good health. I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me again. I do enjoy sharing this information with you. I hope that you do find it supportive. Feel free to reach out and ask any questions. You can contact us on info@holisticdentistry.au. You can also check out that website, holisticdentistry.au, or you can hop on over to evolvedental.com.au. The podcasts are also on there. If you are in the Brisbane area or willing to travel and you would like to see me for a consultation and to get your amalgams removed, then our phone number 0737201811, and we will do everything we can to support you to reach your dental and your health goals. For now, stay in the zone, and I'll see you next time. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.